Hi, everyone. Welcome to our fourth webinar, 3 proven ways to measure the impact of patient and family advisory councils, also known as PFACs. You can find the other recordings on our YouTube channel, which is Healthcare PX. So before we get started, I wanted to talk to you a little bit about my story, and you may know the story already, but I like to honor my sister Joan and tell you. I spent 2 weeks in the ICU with her in 2012, and at the time I was lecturing at UCLA Business School on research, and I had been a reporter, also wrote for the Wall Street Journal, so I was very familiar with researching, and I sat at her bedside all day long, living in the motel next door, and researching and talking to experts all over the country. And then I would go into the family meetings in the morning, and what I found was that no one listened to me. They were very dismissive. And I would find out days later that they had actually incorporated my recommendations. A nurse would whisper to me, "Oh, by the way, we did take her off that medication that you told us about last Tuesday." But unfortunately for my sister, it was just too late and she passed away. So I came away from that tragic experience asking, where's the patient voice in the hospital? And through research, I discovered patient and family advisory councils. So I joined my local PFAC, which was with Kaiser Permanente, and then I was elected as co-chair of the PFAC in Southern California. And the Barrel Institute selected me as their first co-chair of the Global Patient and Family Advisory Board. And I got into research because I was on a conference call and someone said that their CEO refused to start a PFAC because, quote, there was no business case. So I had an MBA and had written tons of business cases. And I thought, well, let me tackle this. And the Barrel Institute was very generous and gave me a grant to do this research. And what I found anecdotally was that PFAC saved hospitals money, improved safety, enhanced the patient experience. And about 5 or 6 years after that research was published by the Barrel Institute, I began to think, well, it's getting a little old, that research, and why don't I go back to school, get a PhD, and I will do my dissertation on PFAC's effectiveness and their impact. And I just finished my PhD last year. So here's what we're going to talk about today. And then at the end, I'm going to tell you about my metrics challenge contest. And this is a contest for PFACs to apply with their best measurement that they've done before and after. And then if you have any questions at all, please put them in the Q&A and hopefully we'll be able to get to them. So here's my dissertation research. I did 3 articles, actually. The first one was on a literature review, and here I looked at articles about PFACs from around the world, 143 of them altogether. And the second one was on a qualitative study, and that was talking to 20 US hospitals who had outstanding PFACs. And then the third one is quantitative, and that was a survey with 220 respondents in the US. And the first 2 have been published, and the second one, I am just finishing up the final proof of it, and it should be published in the next week or 2. So let's look at some of that data that I found. The American Hospital Association has an annual survey that goes out to approximately over 5,000 hospitals in the US. And in 2018, they added a question, which was, does your hospital have an established patient and family advisory council? And you can see here the results of the first time that they ran that question. And then in 2023, it was almost 54%. And I have been looking forward to 2024, which I usually get in December. However, I was told by the American Hospital Association that they have discontinued this question, which I'm so sad about. But I have a meeting right after this with AHA to talk about and see if I can get this question reinstated, because this is really very helpful to know how many hospitals have PFACs. So as you probably know, there's a lot of widespread support for PFACs. There's federal agencies that support PFACs, healthcare organizations, and advocacy groups. But despite the widespread support, I should say, it's very surprising to me that less than 54% of hospitals have PFACs. And I think part of the reason is because PFACs are not measuring their value. I think it's really important to prove the value of PFAC. And my original research 10 years ago, what I found is that when CEOs change, PFACs are sometimes eliminated. And 3 of them had eliminated their PFACs. And when I went back to the hospital and said, what's going on? Why did you do this? They said, oh, we had a new CEO. So I thought, well, what happens there? The new CEO comes in and said, what is this PFAC and what do they do? And there was no value attached to it. There were no measurements of before and after of what the PFAC is doing. So this is why I am so focused that PFACs should have metrics attached to them. And that's what we're going to discuss today. All right, so the 3 ways to measure impact are feedback from presenters, feedback from council members, and measuring the initiative. So in going back to the research, I said, how often do you obtain feedback from the departments about their experience? And here you can see that always and often are a little bit more than a quarter, but never, rarely, occasionally, and sometimes, almost 75% are not getting feedback from the departments about their experience. And this is one of the easiest things that you can do. A department comes to you and talks about an initiative or a problem or a project that they have, and then they leave, and then you send out a survey to them. So you should always be talking to your departments about their experience. And then I asked, is the feedback quantitative or qualitative? And you can see that most of it is qualitative, which is verbiage, rather than quantitative, which is numbers. But really, it should be both. Now, here's an example. So the top part of this is quantitative. On a scale of 1 to 5, how would you rate the following? 1 is poor, 5 is excellent. The pre-planning, the discussion, the value, the impact, your interest in bringing other projects to the PFAC, so that we can start to understand what the departments think about their interaction with the PFAC. And then now let's turn to the verbiage part of this. How would you describe the benefit of the feedback? What was the most impactful idea? And these then can become testimonials. So this form, sending it out to, of course, online, sending it out to departments, can then become the basis for what you're telling leaders about how great the PFAC is doing and what the departments who come to the PFAC think about that interaction. This is so important, and yet it's not being done. Okay, according to the Agency for Healthcare Research and Quality, AHRQ, there are 3 types of measurement. The first one is process, and process measurement is basically numbers. It's activities. It's the number of meetings that you had, the number of PFAC projects that you looked at, or the number of hours that volunteers have. Now, we'll see later that people are just not capturing any of these metrics, which is so important. So wouldn't it be nice if we knew how many hours our PFAC members were putting in? And I saw this at a leadership meeting talking about the PFAC when the liaison, I should say, from the PFAC said that there were over 1,000 hours that the PFAC members had put in. That's not only the meetings, but committees, various projects that they worked on, or whatever it was that they volunteered for. And the leaders' mouths dropped open. This was shocking. I mean, they could not believe that that many hours were being donated to the hospital by the PFAC members. So this is very easy to track. and you should definitely be tracking the process. Okay, the second one is the structure. And this has to do basically with capacity. So the example here is, let's say that we can increase the number of PFACs by 20% by using a toolbox. And this is a webinar that I'm going to be having in the next couple of months. And those of you who are running PFACs are probably saying, no, I can't deal with another PFAC, please. Well, these are hospitals that have 32 PFACs, one, and 20 PFACs, another one, and only a couple of people who are managing them. How do they do that? Okay, so that's going to be a future webinar. And if you're not on my distribution list, make sure that you are, because I'll be sending out an invitation to that soon. Okay, the third measurement is impact. And this is really the gold standard of all measurements. And as I said, this was on the website, ARC website, but these were developed by Donna Beatty, who's done a lot of work about measurement. And this has to do with pre and post metrics. So for example, you have procedure cancellations and it decreased by 50% after the PFAC revised the directions. And we know that this could be connected to money too, right? Because we know that if the PFAC directions, or rather they're improved by the PFAC, that there may not be a fall off as much. And I'm thinking specifically about those pesky little colonoscopy directions that are so complicated. So people get to the reception area and they say, okay, I'm here to check in. And the receptionist goes through all the things that they should have done the night before, and they say no, 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 and they can't have the colonoscopy. So what is that worth to the hospital if you have all these people who are dropping off? It's worth money. Okay, so let's talk now, look at the research and see how often do you track process metrics. So this is really pretty good. Often and always, we have here of almost 60%, which is quite good for process metrics. Remember, this is the number of meetings, the number of initiatives, the number of hours actually as well. But look at all of these people that never track the metrics, rarely, occasionally, or sometimes track these process metrics. This is sad because we, again, want to prove our value. And the reason is because hospitals are being squeezed with money these days. And what I've heard is that departments are closing, people's jobs are being eliminated around patient-centeredness or PFACs or whatever the case may be. And the reason is because the CFO and the C-suite are looking at the numbers and saying, where's our return on our investment for all the time and energy that we're putting into a PFAC? And they can't find that. So that's why this is a great place to start, and it's very, very easy. But now let's look at what's happening with outcome metrics. And here we see the bars are all moving over to the left. Never, rarely, occasionally, sometimes. Okay, only 20% are looking at the initiatives that come to the PFAC and measuring the before and after. This is sad. I mean, of course, it should be always. Now, I'm not saying that you can always measure something, but generally it's pretty easy, and I'm going to talk about that a little later. Okay, what are the steps for measurement? So the first thing that you want to do is you want to discuss the goal with the presenting department. So department comes to the PFAC liaison and says, okay, we need a faster discharge. We've got to get people into the rooms faster. We need more understandable colonoscopy directions, and we should have better food. We're just getting complaints about food. So now it would be your job, and it shouldn't be, but here's what I'm suggesting that you do, that you ask about what are the metrics that you're going to use. So faster discharge, what does that mean? It means from maybe the time that the discharge directions were input into the electronic health records to when the patient actually left the room. Now, in some cases, PFAC and others have come up with the idea of let's have a discharge room where as soon as people are dressed, they go into the room and they wait with others that when the final directions are that they can actually leave the hospital. But this way, the room can be cleaned and sanitized and updated. Okay, so the metric is from the discharge order to leaving the room. Okay, that's what we're going to be measuring. More understandable colonoscopy directing. Yeah, that's nice, but how do we test that? How do we measure that? So again, as I mentioned in the previous example, it's making sure that there's not a fall off when people go to the reception area and they're checking in for their colonoscopy, that it's actually that they're going to have the colonoscopy, right? So that would be what was the fall off, the number of people who couldn't get a colonoscopy because they didn't follow the directions compared to afterwards when the colonoscopy directions are much better, input from the PFAC, and now what's that throughput again? So what are those two metrics? Before the directions were improved and after the directions. And that can be tied to money, as discharge can be too. So the other one is better food. Well, what does that mean? You know, somebody comes to you and say, we need better food or better presentation or whatever it is. So in that case, what you can do is food is not on the HCAPs. It's not mandated by CMS as an HCAP question. However, the third parties, such as NRC and Press Ganey, can add those questions and say, what did you think about the food before and after the input from the PFAC? So you're agreeing on the metric. Whoops. Okay, then you ask the presenting department for that baseline data. That's what you want because you want to make sure that they're measuring. And then you want to measure after the PFAC input. And then you want to analyze that data. Now, it shouldn't be up to you to analyze that data, but unfortunately, PFACs just are not having a lot of measurement, any measurement, as a matter of fact, in hundreds of annual reports that I have read, because they're just not thinking about it or don't think it's necessary. So I'm asking you to request that these departments give you those results. You ask for the pre-measurement. Now, after the input, ask for that measurement as well. And then finally, create a compelling story. So we know that there are a lot of stories that come out of PFACs when they tell their personal experience of what happened to them. Now let's combine that with data and have a story that includes both the data and the experience from a PFAC member or more than that. Okay, I notice that there's a question. I'm going to leave that to the end. But Nadine, maybe you want to ask that later. So how much data? It really depends. You need enough data so that it's enough to analyze. So if you have one fall, let's say a month, that's really not enough data to analyze even over the course of a year. Well, you'll have 12, right? But you don't want to look at a monthly. If you have 20 falls a month, yeah, that works. So you have to look at the time. There is a statistical sample regarding data, and that is actually something that you can find on the internet. If you put in statistical sample, it'll ask you what your total population is, what that total number is, and it'll tell you what your statistical sample should be. You at least need enough data to prove your case. So how do you measure? So you can use surveys, financial data, time, amount, cost, number of. Those are all different types of ways that you can measure. How about displaying the data? Again, this shouldn't be what you're doing, but I wanted to let you know so that if you're working with a department, that when they come back and they give you the report of what happened, that they can display the data in a way that you could use for your report about the PFAC. So here's a run chart. That's January through December on the quantity, for example. The average is the green line that goes across. A bar or a line graph looks like this. A thermometer, this is often used as a goal. A pie chart and a scattergram chart looks like this. So these are all different ways that you can display data. And when they say that a picture is worth 1,000 words, well, a graph is worth at least 1,000 words as well. So the goal is that every PFAC project has before and after measurements. And I'm very hard pressed to think of examples of where you can't measure, but sometimes it's really hard. So let's look at a hard example where the return on investment for the amount of time and energy that goes into getting the measurement isn't really worth it. Let's talk about wayfinding. Now, this is something that a lot of PFACs spend time on, is wayfinding, and communication is the second one. But it would be pretty hard to measure wayfinding. Now, this is putting up signs so that people aren't wandering around the campus or the building and trying to look for where they're going. And what you can do is you could do surveys of patients and families who are coming into the building and ask them if it's their first time. And then as they're leaving, catch them and say, how did you find your ability to locate where you had to go? And we could do a survey like that. Or we could ask employees how many times that they are asked, where is this room? Or how do I get here? And they give it to their supervisor, or they post it somewhere online. They say, I had one person today ask me this or two or whatever it is. And then after the wayfinding signs are put up, then we do the same thing. Well, this is kind of tedious and it's very difficult to do. So this is one example of where I don't think it would be easy to do any kind of measurement. And if you can think of that there is a way, let me know. Another thing that PFACs spend a lot of time on, as a matter of fact, the most amount of time in my previous research that I did 10 years ago, was on communication. So how do we measure the before and after communication of the package, for example, that are given to patients when they are checked into the hospital? So, do we ask them, well, what did you think about this? And then we redo the directions or redo the package, and then we ask again. No, but what a lot of PFACs are doing is they're measuring this with what's called the fog index. And this is on Microsoft Word. And I used this when I wrote for the Wall Street Journal, and my editor said my number had to be 8, which is the equivalent of 8th grade. So it goes from 1 to many, very high. And it's based on, the algorithm actually is based on the number of syllables per word, the number of words per sentence, and the number of sentences per paragraph. Okay, somebody just asked me if the slide stopped. I hope not. You should be seeing goal. Every PFAC project has before and after metrics. Let's see if that's showing. Yes. Okay, so now what happens with this is they put the verbiage into Microsoft Word and it comes out with what that number is. Now it should be 8. Oftentimes it's 10 or 12. That means 10th grade reading or 12th grade reading. But sometimes it's so complicated, the wording, that it's 25 or 30. So now what you can do is redo the directions, keeping that algorithm in mind, the number of the number of syllables, the number of sentences in a paragraph, and the number of words in a sentence, and now measure it again. And that's a valid comment in a report that you're going to do for leaders, that you were able to reduce the level of readership from 25 to 10. So again, you can measure almost anything. Okay, so one of the things that I mentioned is that you want to meet with the departments before they present. So I was very interested in the research to find out how many PFACs have meetings with the departments before they present. And about 30% did, and the rest were never, rarely, occasionally, or sometimes. I mean, you want to always have a pre-meeting with a department and talk about various things, such as besides the metrics and what are they going to be measuring before and after, making sure that it's a short deck, that there's not 50 slides about the history of the department, that they're not using acronyms, that they come prepared with questions, and that you review those questions and make sure that they're questions where the council members can have meaningful input. And finally, then decide if there should be pre-meeting homework. Now, when I was on a PFAC, I loved this because I didn't want to necessarily go into a meeting and talk off the top of my head and answer questions. I like to sit for the problem that the department is having and think about it for a few days and formulate my input that I'm going to have. So pre-meeting homework is really important, in my opinion. So now let's look at the two measurements here. One is, well, two areas, measurement and impact. So the first one on the y-axis here is the ease of measurement, how easy it is to measure. Okay, we know that wayfinding was definitely not easy to measure, whereas the patient intake package, that's easy to measure. So the ease of measurement is high to low. And then on the x-axis, we have impact. And here is low to high as well. Okay, so now let's see where those three things that we're going to measure, where they fall. One is feedback from the patient, from the members, council members. Two is feedback from the department. And three is the initiative, the before and after measurement of the initiative. Okay, so member, that's very easy to do. That's high measurement because you can do that before they leave. You know, just take 2 minutes and fill out our survey on what you thought about this meeting. And there you have it. And make sure that it's both quantitative and qualitative as well. And I know PFACs that actually aim to make that higher, that number higher on what the member thought about the meeting in various ways because that's a goal for them. Okay, it's not that great on impact. So if you go to your leaders and you say, oh, wow, we've had all these meetings, and here's what our members thought about it. On a scale of 1 to 5, it was 4.9. Well, the leaders may not be that impressed with that number because they're thinking, well, they're on the PFAC and they are running the meeting and having input in the meeting, and it's probably going to get a fairly high score. So the impact, I think, on the member is low. Nonetheless, you should still do it. The second one is the feedback from the department. So this is high in terms of ease of measurement. The department leaves and immediately that day or the next day, you send them out a survey. Please take 2 minutes to answer this survey. That's the one that I showed, the quantitative and qualitative on a scale of 1 to 5. And then follow up to make sure that you get it back. If they're coming and asking for advice, they should be willing to follow up and give you that feedback. That impact is pretty high because if you went to leaders and you said, here's what the 10 departments said in 2025 about us, and now you have the measurement, the quantitative, the numbers, but you also have some testimonials. One, a real life testimonial is our thinking turned 180 degrees after we spoke to the PFAC. We were on the wrong track. So that's very important for leaders to know and to prove your value. Okay, the third one then is the initiatives that come to you. So this has a very high impact. Imagine if you're saying that falls decreased by 50% and we save the hospital $500,000 by this, or if you said the throughput for colonoscopies of people who actually come up to the reception area and go through and get a colonoscopy increased by 50%, and here's the money related to it. This impact is extremely high. However, the ease of getting the measurement is low and it is lower than the other two. And part of that reason is because you can't do the measurement. It really has to be the department. But what I'm asking you is to work with the department so that they're measuring and that they're telling you what the results are. Okay, how frequently is the department's implementation of PFAC advice shared with the council? All right, so now we've given our advice as a PFAC member, and now what happens? Well, 60% here said that yes, the department shares what they did with that advice, but a lot don't. And this is kind of a shame. We ask our PFAC members to give us their time, to donate their experience, to give us their brain essentially and tell us feedback. And then we don't turn around and tell them what happened. So a person told me that somebody on their PFAC was leaving, and she was very upset because this person was a great contributor. So in the exit interview, when she asked them why they were leaving, they said, well, I never know what happens. I have no idea about my impact. And I would like to be in an organization where I know the impact of what I'm doing. So members can lose interest if you're not telling them what the impact is of the initiatives. And this is what's considered closing the loop. So another person said to me, well, do we really have to tell them? They can go into the hospital and they can see what their recommendations were and what we implemented. I said, really? We're going to ask the members to wander around the hospital and look and see, well, where did we have that input and what was implemented? No, we shouldn't expect them to do that. We should be telling them, thanking them, celebrating them, that they are giving us great information that we really appreciate. This is so important to do. Now, some PFACs divide their meeting. Part of the meeting is new initiatives that come in, and other part of the meeting is previous initiatives that the PFAC has given advice on. Now, I love that part of the meeting when I was on the Kaiser Permanente PFAC. I mean, this is great. I remember when that department came in, and I remember what people said, and look what they did. They took a lot of what we said, they implemented, and they changed things. This is a great part of the meeting. And my theory is that you're going to retain your members more and attract them when they find out what you did and what the difference was before and after the input. Now imagine you give a potential member a sheet and it tells them all the things that you worked on and the impact that you had. This is persuasive. Okay, how do you promote all those accomplishments that we're talking about? Okay, here they are: newsletter, presentation, report, word of mouth. And we have 8% that are not promoting them at all. And then I asked, how often do you promote the accomplishments? And the majority, 2/3, said annually. But here's what I think. I think it should be monthly. I think every month that you should talk about the great things that are happening with the PFAC. Now, not especially the departments that are coming with their initiative, but the departments that are returning and talking about what input they got and how they changed what they were doing. And what I did find in the research is that the higher the visibility is of the PFAC, that the more content there is. So if you are promoting what you're doing, then you're going to have more content. And there are PFACs that are running around right before the meeting, a few days, and trying to find a department that'll come to them or content. There are PFACs that don't have enough content. And if you're one of them, this is directly correlated. Higher visibility, more content. Okay, the goal is to measure outcomes, but here is the problem. Who gets attribution? And I have been working on this and first heard about it a decade ago when I gave a presentation on metrics up in Ontario, Canada. And everybody was talking about, okay, they come in, the departments, but who gets the credit for what's done? Okay, so here's what I'm suggesting. So the department comes in with their initiative and they're asking the PFAC for feedback, advice, recommendations. But they also want to go to scheduling and they also want to go to member services. So there's value in all of this. And ethically, the PFAC can't say, oh, please, department, don't go to anybody else. We want to be the only one who's giving you advice. No, that doesn't work that way, right? We want to be collaborative with others. We want to be synergistic. More viewpoints lead to better outcomes, right? So the PFAC doesn't want to sit alone here, although oftentimes that is the case. But sometimes the department will go out to more other departments for feedback. So if that's the case, then here's what you need to ask the department who's coming with the initiative. How many other departments are you or did you seek feedback? Which departments is that? And how would you compare the relative impact from the PFAC to the other departments? Okay, this can be on a scale of 1 to 10 or 1 to 100. So let's say the department says, well, we asked three departments altogether, yours, scheduling, and member services, but you gave us the most advice. We would list your contribution as an 8. And scheduling, not so much 1, and member services 1. Okay, so in a report that you're doing to leaders, you can say that the department said that about 80% of the impact was from the PFAC. Now, if you're talking about falls, and each fall it's actually between $15,000 and $50,000 in my last research. Let's just say 60,000. Let's say 50,000 easily. So, and you have 10 falls that you're able to do away with because of your input here. So, it's 500,000. And 80% of that is 40,000. So, now you can tie money to this and you can say 80% of the 500,000, 40,000. That's what we were able to save the hospital. So important. Okay, why are metrics important? Okay, let's look at the ecosystem. So it's important to tell the patients that we listen to them. And this can be in a patient-facing newsletter or social media. You told us about the food, we improved it. And oh, here, by the way, our scores increased by X percentage on the NRC or the Press Ganey, for example, survey. So talk internally to the hospital to grow the number of PFACs. And again, I'm going to be having that webinar on hospitals that have 20, 30 PFACs and see how they do it with so few people. You can increase your content. What about increasing your budget if you're letting the hospital know about the changes that departments have made based on the PFAC input? So let's go out to the community, to the newspaper, or to anything else and talk about our patient-centeredness, right? And then we can tell the hospitals and the rest of the world. Now, there's several groups that are very interested in this, for creditors, for example. So the Joint Commission interviews PFAC members. So this will help with that. let me go back up here. CMS attestation. There are 5 domains that are required by CMS now. One of those domains is patient engagement. And in that domain, they talk about patient family advisory councils and, of course, HCAP scores tied to money. So this is why metrics are important. And if you're running a PFAC, it could influence your career. If you're telling the hospital how much money you saved because of what happened in the PFAC, believe me, it'll influence your career. Okay, if you want to read more about metrics, and here is an article that I wrote. I'm going to copy and put this into the chat. Let's see. Let me see. Oh, sorry about that. I just had it. Okay, and that was by the published in the Journal of Patient Experience. And then finally, before we open for questions, this is a challenge that I'm having. It's the Black Belt, which is based on my Black Belt in Karate, PFAC Metrics Challenge 2026. So the goal is to recognize PFACs that have demonstrated measurable outcomes from hospital initiatives. It has to be work that was done in 2025. Here is a link to the application. And the deadline is coming up on January 26th. So if you want to apply, please do. Okay, we have a few minutes here. Thank you, everyone, for attending. I really appreciate this. Okay, if you want to raise your hand and ask a question, Giselle, if you have any questions that you're seeing in the chat. Okay, Martha, go ahead.
Hi, thank you so much. Your work is so useful and I'm like so excited. Um, were you saying, I'm so curious to see, I'm not sure if they share it, but the hospital that has the toolkit to help them replicate, is that something we can look at or review?
Yes, hopefully, yes. I understand that I had asked in the interview if that was available, and I believe the answer is yes. You know, people are not keeping this stuff to themselves. So when I have that webinar, which I'm hoping will be in February, I will be hopefully
Oh,
including a
awesome.
toolkit. Okay. Just
Okay.
make sure that you are on my distribution list. Okay.
Okay. I'll double check. Thank you so much.
Okay. Thanks a lot. Okay. Anybody else? Giselle, anything in the chat that maybe, let's see, regarding wayfinding. Okay, our PFAC did, oh, okay. Work on outpatient areas, added a question to our outpatient survey. Did you encounter any challenges? There you go. You don't have to walk around. You can add this to a survey. Oh, thank you so much, Christine, for doing that. Fantastic. Okay, Lori.
Yes. In the chat too, sorry,
Okay,
Terry
go ahead.
asked how you get on the mail list, the mailing
Oh,
list.
here's my email address. Just send me an email right here, and I will drop that in the chat. Okay. Anything else, Giselle, that you see?
No, not at this time.
Okay. Let's see. Lori, we don't meet with every team every time because we have a number of departments that come regularly. We do have pre-event material with meeting homework, a slide deck template, and an email follow-up to be sure they have what they need. Okay, good. Good. And
We
Nadine.
have a couple of hands up
Okay.
too.
Oh, sorry. Becky, go ahead.
Hi. I was just responding to the person who was asking about toolkits, and I don't know if this is relevant to that, but AARP did a toolkit for PFACs that is on the NoBox website that you can go get and download and use right away.
Thank you, Becky. Yeah, I've reviewed that PFAC and that toolkit.
Yeah.
And that's it's helpful, but this particular toolkit deals with how do you manage 20 or 30 PFACs with just a couple of few people? And they
Okay.
specifically set something up in order to do that. And it's very, very good. So I'll be talking about that. But thanks a
Okay.
lot, Becky.
Okay, no
Buzz,
problem.
how about you? Your hand is up, Buzz?
Yeah, I do. I don't belong in this conference. I am the co-chair of the PFAC, not an administrator of PFACs. But I thought I might learn something, and I did. I extrapolated some of the things you talked about. Though, and I'm co-chairing a brand new PFAC, so we've only had like one meeting, and it's not clear to me where the source of the projects comes from. I got the impression in listening to you that it's the departments that come to the PFACs and say, help me with this,
That's right. So
as opposed to
originally,
the PFAC saying, give me all this data and we'll come up with a project.
right. So initially, 1.0 PFAC years ago, 10 years when I first joined, a PFAC at Kaiser Permanente, it was gripe. It was basically a gripe session. The people sat around and they said, we'd like this changed and we'd like that changed. And then it started moving toward what I call 2.0, and that is where the department came with their initiatives. And if the members had ideas, then they filled out a form and they put it into and submitted it so that there could be ideas from the PFAC that are coming, but most of them come from departments. So these are departments that are looking for feedback from the PFAC. Now, when I've done research in corporate America, which I was for 2.5 decades before my sister's death and I started working in health care, I found that every single industry, if I flew, I got a survey. If I had my car in, I got a survey. If I bought a computer, I got a survey. Every industry is looking for feedback from their customers. But healthcare is really late to the party in doing this. They were never interested. I mean, and I'm not sure why. I've had discussions with people who have various reasons why, but now they're, because of the data that we have, and hopefully because of the metrics that we'll have in the future, more and more hospitals are interested in this. So, Buzz, did that answer your question? It comes from the departments.
That helps because I wasn't getting that sense in our first meeting that they wanted to bring forward the issues, but rather have us identify issues that we want to look at. And I just wanted to get your opinion on that. Thank you. That helps.
Yeah, you may have to start with their issues that they have because departments don't know about the PFAC yet, or they're not thinking like that. But generally, the better way to go is to have the departments. And one of the best departments to start with, if you have one, is improvement, the process improvement department. They all oftentimes are looking at stuff. And if anything is patient facing, we should be asking the patients what they think about it.
So your
Okay,
sense is take patient surveys and help the departments interpret what the feedback they're getting from patients.
say that again.
They're already surveying patients.
Yeah.
Departments are getting that feedback. And I think what you're saying is ask the question, what is it about those surveys and feedback that they need help with?
Okay, right. So
Okay.
what's happened in a lot of hospitals now is that they're dipping their toe in the water with getting patient feedback, and they're going to e-advisors. And this is just thousands of people who have signed up to get a survey once in a while. And then what happens with these hospitals is that some of them are taking the results of the survey, they're bringing it to the PFAC and say, okay, here's the results of the survey that we got. Let's have more of a discussion around the answer here. Why do you think this or why that? So it's oftentimes it's a combination between the two, the survey and the discussion. And let's see, who else? Anybody else have a
Robin might have a comment.
Okay.
Hi, this is Robin Smith. I'm at Driscoll Children's Hospital. We've had a family advisory board, gosh, since 2004. We've done lots of different projects, been on lots of different initiatives, provided feedback constantly. One of the things that's been so successful with our group is when we don't measure. So I'm super, super, super excited to have heard all of this. I am like scribbling like there's no tomorrow. I'm super excited about that. But one of the things, a comment about what you were just talking about, we had our patient relations come and talk with us about the results of the satisfaction survey. And one of the things that they asked us specifically was, how do we move our number? We're doing great. We're doing fine, but how do we move that number? Because what happens is they get the feedback and then they go to the staff and they come up with all these ideas. But getting direct feedback from the Family Advisory Board is so helpful because they're like, oh, well, this is what the question means to me. This is how I answered it. This is what I think you could do. When I've gone to these clinics, this is my experience. So it has really been helpful. And again, what we haven't done is how helpful has that been? So I'm excited to really look at how we measure some of these things each year. We do it quarterly, but we also do it each year. We talk about all of our accomplishments, all of our achievements. What have we done? We've renovated treatment rooms when we've done the walk. We do walkabouts every year. What would we like to see differently? We've redone playgrounds. We've done a lot of bigger projects, but some of these little projects, like discharging complex patients in a pediatric environment, are they using Teach Back? You know, recently our family said, no. None of us did any teach back. I think they assume that we know so much because their kids come frequently. They assume we know, but there's things we really want teach back. We want you to do teach back. So we're going to do a big initiative this year about what does teach back look like. Maybe even come up with, we'll talk with residents, we'll talk with physicians, go to maybe do a grand rounds. But really get the word out on what Teach Back looks like. And yes, even us that can probably teach you how to do it to our kids, we still need Teach Back stuff. So anyway, it's just, I'm super happy to be on this group. I've learned so much. And if I can help anyone else, I'm available as well.
Thank you, Robin. I appreciate that. So
You bet.
when
And I
you get
talk
this
really fast,
measurement,
so sorry.
when you get the measurement, hopefully you can be participating in the Black Belt PFAC Metrics Challenge of 2027.
Oh,
Okay.
you're on. I'm
Okay,
there.
good.
We are so excited.
All right,
Yes.
we have to wrap up. We are 5, 8, 7 minutes over here. If I didn't get a chance to get to your question or talk to you or anything, you've got my email address. Did I?
I
Is it?
added it.
Yeah. Okay,
I
okay.
put it up there too.
Thanks so much, Giselle. Really appreciate you, Giselle, and helping me with this. And thank you, everybody. This will be online on my YouTube channel. If you want to subscribe to the YouTube channel, that's great because I post videos up there that aren't part of the webinar. I just did one on how to tell a story using the 3 ways of identifying the problem, solution, benefit. You know, sometimes we have people who wander around and talk a lot and don't actually get to the point fast. So I put a little video up of what it looks like to do it correctly and then the wandering around. So go ahead and join that if you want. Thank you, everyone, so much. So appreciate your support and your interest in this. And please go forth and measure. Thank you.
Thank you. Bye.
You're welcome.